When we think about, back to the illicit drugs example that I gave there from that psychographic segmentation, what's the product? What are we offering? For those lower risk people who aren't using drugs much now and have already got a pretty negative attitude, it's about the avoidance of experiencing negative health and social consequences associated with cannabis, ecstasy and amphetamines. Those are the three drugs targeted in that federal government's national campaign. For thrill seekers, it's about positive life experiences and outcomes without using drugs, credible alternatives without using drugs. And for reality swappers, it's about support and assistance in tough times. And these terms, reality swappers and thrill seekers, are simply labels that the research company gave to them. But you know the people that I'm talking about in terms of, for those reality swappers, to tell them drugs are dangerous is an absolute waste of time. They know that. But it still feels better to be stoned than to be straight, according to this, in terms of the situation that I find myself in. For the thrill seekers, telling them that drugs are really dangerous can be like an ad. That might be exactly what they're looking for in terms of that risk. So you have to be very careful about generating an intervention which will be both effective and not counterproductive to other elements or other segments that you're targeting. The price considerations there. For the lower risk, not much really, just an effort to become more informed, so they just need to absorb stuff that communication that reflects where they're already at. So it's not going to be very difficult for them. It's going to be quite easily to be reinforced. For the thrill seekers, it's about potentially loss of perceived risk-taking potential, enjoyable opportunities they might associate with drug use. For the reality swappers, it's about acknowledging the need for assistance and efforts to seek and engage with that support and assistance, or be willing to accept that support and assistance. So three quite different strategy arms that need to be implemented simultaneously, not just one and then another one later. These are relevant to all the young people there, and they need to be implemented in a way that are supportive but not counterproductive. So what we're trying to do is reinforce negative attitudes towards illicit drug use amongst the lower group in a way that is not excitable for the thrill seekers. So we need to pre-test the intervention with the target audience we're aiming at, the lower risk, but also with the thrill seekers to make sure it's not going to be exciting for them to see the way the drug is actually portrayed. Promoting alternatives and credible role models for the thrill seekers, and promoting support and treatment for the reality swappers. Service providers, of course, are going to be very important in that mix as a parents in terms of that comprehensive strategy. One of the most important elements that I mentioned there was about self-efficacy. Now, when you go out and ask parents, or when the government asked parents about their willingness to talk to young people about drugs, most of them were very reluctant simply because they felt that the young people knew a lot more about it than they did. They didn't want to feel ignorant or stupid in front of their young people. So one of the most important elements in terms of the parent intervention was showing an ad of other parents raising the issue. And it was fascinating to watch parents in focus groups and in pre-testing of some of this material, that in seeing this, it sort of dawned on them, well, yeah, I guess it's not that hard after all, is it? Can I just show that?
I'm in the under-9s. And I'm a
I hate this.
What's up?
It's that ad for drugs. It's horrible.
Well, drugs are a big problem. Worries the hell out of your father and I.
How come?
Do any kids at your school do drugs?
Yeah, I suppose.
Well, that's why. What would you say if someone offered you some?
That's a good point. What would you say if someone offered you some?
I'd tell them no. Never know what it could do to you.
No one at school takes it.
Mum, did they used to have drugs around when you were young?
They did, but it's a lot worse now.
Why?
Well,
We should probably talk about drugs with the kids.
You don't know anything about drugs.
We should find out.
One of the best ways of preventing drug use is by talking to your children. Soon, every home in Australia will receive this booklet that tells you things you need to know about drugs and how to talk about them with your family.
Please look out for it or download it from the website.
we should read that.
Yeah.
Authorised by the Australian Government, Canberra.
This is a very simple strategy about self-efficacy. If parents don't feel any confidence about raising this, they're not going to. So, I mean, it was a very large-scale intervention, clearly, and it was about a letterbox drop with a booklet to just encourage that. But the principle is really important. If people don't feel they can do something, you need to have something in your intervention which makes them more confident that they can. And then there was communication using vignettes Again, thoroughly pre-tested with young people about cannabis and posters there for cannabis, ecstasy, and amphetamines. And I won't show you these, but just a series of vignettes about the negative consequences associated with that. But I will show you this last one. In terms of that thrill seeker stuff, this is not easy to get right, but this was a small vignette that was run through Cactus Garden and Fuel TV action sports television programs, which was about, it doesn't feel very government-y, but it was from, when we talked about branding and positioning, it feels like it's coming from the television, this station or this program.
Hi, I'm Jay Onley. During 10 years of the World Pro Snowboard Tour, I saw a lot of friends and talented athletes use and abuse drugs. Riders who could have been big names in the sport just vanished. What I noticed is those who avoided drugs gave themselves the best chance of achieving their goals and reaching the top. I wouldn't have achieved any of my goals if I wasted time using drugs. Only by staying focused and making positive choices do you give yourself the best chance of success.
I'd never heard of this guy, but if you're a snowboarder, or you were back then, you knew all about this guy. That was him doing that sort of stuff. So he had great cred in terms of the particular segment, and there were a whole lot of different ones of these, targeting quite a lot of different segments, if you like, of thrill-seeking young people. Just an example then of both the reinforcing the negatives, but also if you've got some people who've got to do something in terms of that thrill-seeking, you need to be not saying stop being a thrill-seeker, that just doesn't work, but there are other ways of thinking about achieving what you want to actually achieve. So having done all that, we then implement strategies and undertake process monitoring and evaluation against those key indicators to measure change along the way, and of course undertake evaluation, and then go through a process of review at the end of each cycle to say, well, what have we learnt through understanding the problem there, understanding our target audience, implementing things, pre-testing them, monitoring the implementation and evaluation to look at the next stage of it, next stage of cycle. But to conclude, in going through the process itself, I must admit, in first talking with Peter Hommel and then looking at just some of the examples and case studies that I came across in looking at this, there certainly seems to be a lot of areas where there are lessons that can quite easily be translated in terms of crime prevention and community safety interventions. I hope some of those have been clear in what I've been talking about now. But the reality is, if you need to influence a voluntary behaviour, there are a set of principles and a process that can go through and increase the likelihood of you actually having success in terms of that behavioural intervention. Thank you.